We're back, and I am BKP, your host, and we're coming to you live from downtown Blue Ridge, the shops at Sycamore Crossing. We're excited to be here every Friday morning. You can hear the train whistle. I mean, America, Blue Ridge. My guest now is Dr. Whaley. Now, don't forget, we have Candace Youngberg of Crawford Collections going to stop by, tell us about her shop in just a minute. But I'm joined now by Dr. Whaley. Dr. Whaley, how are you this morning?
I'm great. Yourself?
You know, I sent you a message, and I want to get right into it because it is something people are talking about other than conventions and politics, and it's one of the concerns that some people have, the Zika virus.
Yeah.
And I asked you yesterday, I said, let's talk about the Zika virus.
Well, I tell you, I'm a lot more happy talking about the Zika virus than I am a tragedy. Both of the last two Fridays, we've been talking about a mass murder tragedy. And to talk about the Republican convention and to talk about the Zika virus feels like we're back in the real world. So here's the deal on the Zika virus. Zika virus is a mosquito-borne illness. The mosquito is a nasty little bug. Worldwide, more people die of mosquito-borne illnesses than any other organism-transmitted disease. HIV deaths are slightly over 1 million a year. Mosquito-borne illnesses are slightly over 1 million a year. And the Zika virus is the newest. Nobody is going to die of it. So when the hype about the Zika virus comes up, it is 100% the birth defects that occur in women who get the Zika virus while pregnant. Now, switch gears and put your mind on German measles, back to rubella. When I was a kid, everybody got rubella. If a woman got rubella in the first trimester of pregnancy, she had a high chance of having a birth defect baby. So there was just tremendous national pressure to create a rubella vaccine.
Right, okay.
So now, rubella is a thing of the past. Just like HIV. They'd like to have a vaccine against HIV. We don't have one. There's no vaccine against the Zika virus. There were no cases of reported Zika virus infection, 14, before 2007 in the United States. And I went online yesterday. I was going to get Dr. Steve Marlowe on the phone this morning, if I told you. He's off doing grand rounds somewhere. But he's our big viral research expert there in Atlanta. And Steve was first a researcher when the herpes virus was the big deal, then when HIV became the big deal. But he sent me this report from day before yesterday, the 20th of July, of the CDC, and they say there have been no locally reported mosquito-borne cases of Zika virus in America. There have been 1,400 travel-associated cases.
Where they're not born here, they travel back.
Right, it was not caught here. People went on vacation.
Yeah, they got it in South America somewhere.
Somewhere, South America, could be Africa, but
so
mostly South America.
That's the ones when we say it's here in America that we're hearing a lot. They're travel.
They are travel.
But now we're going to talk about born here.
Well, don't make it where you're born.
No, I mean the virus.
The virus. We are. We're not going to be afraid of it, but we're going to talk about it. There was one case that was transmitted in the laboratory. Now, this is now 48 hours ago. Yesterday, Florida reported in the morning that they were investigating one case that they thought might not be sexually transmitted and might be viral transmitted, and by late afternoon, they had a second case. So there are two cases in Florida that they're investigating today, and that does not mean that they were acquired in Florida. It's like HIV. Early on, people were very reluctant to talk about their sexual habits. And the cases that we know about that have been human-to-human transmission in the United States have been sexually transmitted. So if somebody has the Zika virus down in Florida, they haven't been on vacation, and the doctor says, well, if you haven't been on vacation, have you been having sex with somebody? There may be reasons they don't want to report that. And so generally when the CDC starts to work on this, a lot of those cases are ultimately explained. Now, they're also looking to find the Zika virus in a mosquito. Now, you want to talk about a 1 in a billion. The only way they'll find a Zika virus in a mosquito is if he bit somebody that had the disease and is down there in Dade County, Florida, in all those other millions of mosquitoes, and they can find it. So it's very unlikely that they're going to discover that virus in a mosquito. I think what people really need to know is that this is not the only illness that you can transmit in Fannin County in North Georgia. We have the West Nile virus and we have all these other viruses. It's incidental, but I almost died of Japanese bee encephalitis that I acquired in Vietnam, and that was a mosquito-borne illness. So what you really want to talk about today is how you going to get the mosquitoes out of Fannin County. And then after you got the mosquitoes out of Fannin County, if you're a young, healthy male or female in your childbearing years, I'd just tell you not to go to the Olympics and not to go to Central or South America on vacation, because the chances that you can get that disease, transmit that to each other, and have a birth defect are way too high for me to feel like it's safe. The conservative way is
so you're concerned with travel to Rio and the Olympics at this time?
Absolutely. Jane and I were in Rio just a few months ago. You can take a match and light the water they're going to be doing the rowing events on, and they're blowing mosquito repellent everywhere. But there are thousands of cases in South America and in Central America, and I am 100% with these young golfers who have decided not to go because they have wives of childbearing age that they're worried about. The Zika virus, nobody's going to die of it. The symptoms of the Zika virus are basically you get a rash, you get a fever, you get conjunctivitis, and it's like a lot of other illnesses. Many cases don't even know they were sick. If you can remember to your adolescence when mononucleosis was going around, people would have call it the kissing disease, but if they came in there, they found out that 10 other people had antibodies to the monovirus and were never sick. You've got people all around you. We talk about giving them a shingles shot. They said, well, I never had chickenpox. Well, did your brothers or sisters have chickenpox? Yeah, they had chickenpox. They said, you had it. If you were in the home of somebody that had chickenpox, you've got the chickenpox virus in your body. You had it, but you were never sick. Well, that's the way the Zika virus is going to be to a huge proportion of patients. Many of the other people who get the Zika virus aren't going to say anything about it. They're going to think they got a little case of the flu. They are not very sick. So here is where I believe that the really big danger comes. And I had this thought early in the HIV epidemic. This is the CDC's recommendation for a female traveler who has been in a Zika virus area, have no sex for 8 weeks after return. How many young adolescent women are going to do that? But listen to this. If you are a male traveler and you have been in an area, don't have sex for 6 months after returning.
I'm not going to Rio.
If you've had any symptoms of the Zika virus. Well, the point is the symptoms of the Zika virus may not exist.
No, see, now I'm really understanding why you're saying you support the golfers' decisions not to go, because there has been some talk like, well, they can't get pregnant, and why are they saying they won't go? Well, hey, right here, medically, they're saying the warnings are don't have, sex for 6 months. These are people that are, not the women, the men.
Correct. That's the advice to the men.
Right.
6 months of contraceptive protected sex with a condom. It doesn't say birth control pills. With a condom for all sorts of sex for 6 months if you've had any symptoms. Well, remember that the symptom might be nothing but a fever.
Right.
An athlete playing golf, they have fever all the time. I did the first aid station at the Masters when I was in medical school for 2 years in a row. I treated them for tonsillitis and the flu and everything else. I mean, it's ridiculous to believe that an adolescent, young adult, male, who is going to be spending 2 to 3 weeks in that nasty water and down there sweating in his singlet, isn't going to have a mosquito bite. I mean, they can spray all that stuff they want. And if he has a fever of 99 one time, unless he comes back and they send his blood to the CDC and check it for the virus, your doctor can't. So they tell you that the test is diagnosed by symptoms and by a blood test and a urine test. Well, that's not one you can do at the local hospital. That's got to go to the CDC. We don't have the technology yet to do that. Yes, they can do one there for flu, but they can't do one for Zika virus. So I'm just telling you, stay away from Central and South America unless you're our age.
All right, stay away. Stay away from Central and South America, but you know, we have that thought of, well, that's South America, Central and South America, but to me it's too close to home, and what are they doing to combat this, and are we helping in any way? What's happening?
Okay, well, Jane and I had the opportunity to spend the weekend with the 20th anniversary of the Olympics with the National Olympic people for
I seen
36
some pictures.
hours.
Carl Lewis.
Oh yeah, did you see the picture of Carl Lewis?
Somebody texted them to me. I don't know.
Oh, really? It must have been Jane.
Oh, I don't know.
Anyway, so yes, we had dinner with Carl Lewis and some of the gymnasts and everything. Anyway, there was a lot of discussion there, and the people that are advising the Brazilians about it, they've been working on these mosquitoes for about 6 months, and they've gone into everybody's backyard and taken their flower plants and turned them over, and the tires that are out there, the junk and everything. But remember, Brazil is a lot different country than North Georgia.
Right.
And there are many places that aren't turned over garbage cans or turned over tires where mosquitoes can breed. Now here in Blue Ridge, you go into your yard, you turn your thing over every week, every bit of standing water, the boots out of the garbage, but you got these dumps all in the woods out here. Nobody cleans up the dumps. That's where mosquitoes breed. So
water lays in the valley of the tires. And
yeah, right. The tires, the old the boots, tin cans, anything that'll let water pool in it, those mosquitoes can breed. And in our area here, your dog heartworms. You're giving your dogs these pills to keep them getting heartworms. That's a mosquito-borne illness for dogs. You got all your horses around here. We have them every year that get the West Nile virus. There's not a year that goes by that we don't have several cases of West Nile virus in North Georgia. Now, people don't think that they're worried about Zika virus, but the Zika virus, I don't believe, is going to be a public health issue in North Georgia.
I agree with that.
Yeah. Now, if those 2 cases in Florida are real, and if they determine that they were mosquito-borne, those mosquitoes, there's two different types of mosquitoes. We won't go into them, but if you look at the map, and I've got it here for you, that anything that had a Confederate flag on it is in the area where those mosquitoes breed. Ohio didn't have a Confederate flag, but it's in it, down to southern Pennsylvania and across to southern New Jersey. So if you just look maybe at the Mason-Dixon line in south and a little bit higher, every bit of that's the mosquito habitat of the mosquito that can carry dog heartworm, dengue fever, West Nile virus, and the Zika virus. Now, it is not impossible to believe that the Zika virus can undergo some mutation like the HIV virus did, become much more potent, and then you might have an epidemic. Remember that all of these viruses, the easiest one's flu. This year you get a shot for Spanish flu, next year it's Hong Kong flu, and every year they change the recipe for the flu virus.
Right.
And that's one family of viruses. Well, if you get Zika virus, remember, there were no cases in this country other than 14 travel-related cases before 2007. You got 1,400 now. So this is really so new that we don't know what's going to happen to it. So my own personal advice is go on the Consumer Reports website or the CDC website. It'll tell you which of the mosquito repellents to use and which ones not. There are commercial ones that are good and there are commercial ones that are not good, and there's no sense in us trying to straighten it out for you. Wear these long sleeve shirts. Some of these shirts that Columbia makes are actually impregnated with anti-mosquito stuff. Put it on your face and your neck and your hands. Turn over all the water in your yard and go on outside and have a good time. Quit worrying about the darn mosquito. But take those precautions not to be bitten by the mosquito now, right now, in North Georgia. You don't like a mosquito anyway, it itches. But, West Nile virus and the other ones are there. Take care of it.
I'm concerned about Zika virus. I don't think I'm as concerned here as what we're bringing back into this country. That's always concerned me on a lot of things. So I'm more concerned with what they're doing and how to prevent it from coming here.
I believe you're right on the money. Well, we've talked before privately about the fact that bringing in immigrants is a pathway to ISIS.
Right.
We don't know who they are, where they come from. All right. Early in the HIV epidemic, we were bringing into the country people that were infected with the HIV, that were in the category of IV drug abusers or others, and the cases began with Belgium. There was a Belgian flight attendant brought it into the country. Now, it is correct that we bring into this country through our travel and through our immigration other infectious diseases. Today, almost all tuberculosis in this country is in people that are immigrant to the country.
Yes.
All right. Now,
we had tuberculosis pretty much contained.
Yeah. Well, I got TB in Vietnam too. Yeah, we had TB. TB was pretty much wiped out. But anyway, the point I'm coming to is that when my grandfather was in the public health service at Ellis Island, they would separate out the immigrants based upon their ability to earn a living and be productive citizens. And if they did not meet the test, the intellectual test, they sent them home. And that group they called imbeciles. He invented some tests that they could find a trainable group in the middle that you might be able to say work in an entry-level job. And he called that group morons. Well, the old issue was about the immigration. They did not want to bring in a population of people who would bring a lot of social needs. This virus is going to bring a lot. Already we know of several hundred microcephalic disabled children that the public medical system is going to have to care for. These children with these birth defects are like the ones we talked about last week, right, with the special needs for seizures, who had the marijuana oil is a reasonable product for. Well, it's the social and medical debt and load that those children are going to have, the tragedy and the agony it's going to cause the parents. That's the bad thing about the Zika virus, not the fact that for 10 days you're going to have a fever or rash and your eyes are going to be red.
Well, Dr. Whaley, I appreciate it very much, because I was trying to bring together the travel warnings, because I've heard so many things all over the map on travel warnings from the media, why the golfers were not going, traveling to Central and South America, the cases that were coming back to this country. And I want to thank you so much for sitting down with us and explaining that and help clearing up to me, because now I understand why the golfers are not going. They can.
That's not only golfers; it's also tennis players.
Well, no.
But the golfers the golfers were the guys with the millions of dollars.
Yeah, but several of the sports they're not going. Well, Dr. Whaley,
I'd be kind of happy if they also didn't let the Russians come. You know, we haven't talked about.
Well, see, I was afraid to bring that up. I was afraid to bring that up because we only got about 25 minutes in the morning, and I didn't know if I wanted to get it. You know, they won't let the Russians be in the Olympics for performance-enhancing drugs because it's against the rules. But yeah, Hillary can be president.
Yeah, right.
I got to quit on that. You have to get to work.
Yeah.
We don't need to get sidetracked.
And I would love to sit around here and talk about the convention. If you got to go to a hard break.
Yeah, we got to go to a hard break. We've got to go to a hard break, and I have a lady that has to come in that we have scheduled.
All right, hit the hard break. I want to tell everybody we're not going to be here next Friday because I'm going to be with my grandkids. So it'll be 2 Fridays before you see me back from 8:15 to 8:45.
We got to go to break. We got Dr. Whaley here. We've been talking about the Zika virus. We're going to talk in just a minute to Candace Youngbird of Crawford Collection. Go spend a couple minutes with her, and then we're going to get a group in here and talk about the Republican convention and what they thought about it. So I'm your host, BKP. Lonnie, take us to break.